Hi, Dr. Moore here again. Today's segment is going to be on pediatric chiropractic. I find this is important because all too often there are a number of people that don't realize that chiropractors can be pediatric chiropractors. Today we have with us here Michaela. Now in this case Michaela happens to be my daughter. But Michaela's been getting adjusted, so to speak, since about the day that she was born. Michaela was born with a little bit of hip dysplasia. We had some concerns for her low back, her sacral area, things of this nature. Chiropractic was found to be a very successful tool. Now, the first thing is many people that get nervous when they hear pediatric and chiropractic is crunching, popping, cracking of my poor baby spine. You know, I go to hospitals and I do well baby checks on little ones that were born that very day. I also have patients that bring many of their newborns into us. That could be nothing further from the truth. But mostly with infants, it's all about just checking the child neurologically and then discussing things with the patients, mostly to give the patients a little bit of how to help their own child on their own at home in a safe manner that they can do that. As a matter of fact, when it comes to adjusting a child, it might be like this. Many people envision a big pressure, and it's not. It could just be a pressure like this. Okay, Michaela's going to give us a little bit of an example here today, just so you get the idea. Michaela, go ahead and lie on your stomach here. Now, the key element here is that children, just like adults, have a spine. Okay, and the principle by which chiropractic works is the nervous system to be completely communicating at 100% for you to be 100%. You got to eat right, you got to drink right, you got to breathe right, all clean sources. But if your nervous system's not working 100%, then things won't be working properly in your body. So her spine, although smaller than this one, is just like anybody else. And when there's imbalances, see often in the adult, those imbalances have been there for so many years that they become degenerative. And they've basically waited for so long that the little problem became a big problem. So that being said, it's a little bit more like brushing your teeth. Why would you not learn how to take care of a problem if it exists when you're young versus a problem that you let become huge when you're older? So we do that at the pediatric level. And in this particular case, Michaela here is 11. But we go through in much the same way. And I'm going to go ahead and just see if Michaela needs to be adjusted. By the way, if watching in any of these videos you have questions, by all means, please email us those questions and we'll do everything we can to make sure we're clear and that we've answered your questions. So this is an activator. There will be a different professional video on that. Over the years, we've taken care of literally thousands of children. It's a very safe and effective form of health care for children out there. I also do a lot of athlete care. It's great for athletes. Yeah. Okay. Nope. And that's it. She's good. So she can come on up. And it's a great thing because most of the little kids have been getting adjusted for years. We'll just hop right up on the table. They already know. Sometimes they jokingly call it popcorn or getting their power turned on. But they already know. She's been getting adjusted since she was 11. In her particular case, again, with hip dysplasia, made a huge, huge difference in her life in terms of how she can move and function and play soccer. So it was all about getting her low back moving properly instead of just bracing her and then moving. We did both at the same time. But you got to know what you're doing with that. But pediatric care is immensely important. More people that would get proper pediatric care and pay attention to their issues earlier in life, they won't become those big issues later in life. So again, we thank you for watching this video. We hope you take a look at some of the other professional videos as well as some of the patient testimonial videos. And again, give us any feedback you like. Have a great day. We'll be talking with you soon.